Good morning, ladies and gentlemen. I am Dr. Manoj Sharma, Head of Department of Spine and Orthopedic Surgery, Jaipur Golden Hospital, Rohini, Delhi. Today, I am going to speak about how to prevent spine surgery in patient of backache. Nobody wants to get the surgery, and we should try to avoid it and prevent it. So, are there ways out where we can prevent the spine surgery in cases of backache? Yes, of course. Let me tell you a very good news that almost 90 to 95% of the patient of backache don't require spine surgery. They become fine with very ordinary treatments like medicines, physiotherapy, exercises. So there are very few, 5 to 10% of patients who will require the spine surgery. One of the most common causes of spine surgery is the slip disc, which can happen either in our cervical spine or neck, or in the lower back or lumbar spine. Now this happens because of repeated trauma and jerks, and how to prevent it? The prevention for this is that we should acquire a proper posture. Like in the cervical spine, we should avoid pillows and lie straight. Do not do works where we have to look down for a very long time, like in computers or anything else, or using our mobile phones. And we should do regular exercise to strengthen our muscles of the cervical spine. Similarly, in the lower back, we should avoid jerks, sudden movement, or lifting very heavy weight where it can jerk our back, because this can put pressure on the disc, which can herniate out or bulge from back, or which can rupture. Now, at the same time, we should keep our bones stronger by taking adequate vitamin D and calcium. So, if we do regular exercises for our cervical spine and back, acquire a proper posture, and take adequate diet, I think we can prevent the cervical and lumbar disc herniation or the slip disc. The second most common cause of the spine surgery is the degenerative spine, where we can have the diseases of the middle or old age, where we can have low back pain because of the lumbar spondylosis, or the cervical pain because of cervical spondylosis, and then ultimately it can travel down our arm and leg. Now again, this can also be prevented by avoiding the jerks, taking medicines to strengthen our bones, and do regular exercises, and preventing the injuries to the cervical spine and the lower back. Because all these things happen with the micro and macro traumas of the spine, which can be prevented if we are careful about our postures and about our activities. The third most common cause of the spine surgery is the osteoporosis, where we can have the fracture of our bones. So osteoporosis is a disease of the old age, especially in females after menopause, because of the deficiency of the female hormone called estrogen. Now this is very essential for strength of our bone. After menopause, our bones, especially in females, tend to become weaker, and we call it osteoporosis. This can cause the spinal fracture with very trivial trauma, or even while we are bending, we can have the fractures in the spine. Now, this can be prevented by doing a test called as DEXA bone scan. And if we have got symptoms, and if it says that we have got osteoporosis, we should take proper treatment for that, and it can be prevented. So the fractures can be prevented by taking medicines like vitamin D, calcium, and there are some injections which can be taken, like injection teriparatide and others, which can make our bones stronger, and osteoporotic fractures can be prevented. The other diseases which might require surgery are like spinal infections. The most common in India is tuberculosis of spine. So if we can catch it in early stage, so whenever our spinal pain becomes chronic, like more than 2 to 3 weeks, we must consult a spine surgeon so that our disease can be caught at early stage, because all spinal surgeries, because of the infections or tumors, can be prevented by the medicine if we caught and the treatment started in early stage. So in tuberculosis of spine, if the treatment is started early, the medical treatment can cure the spinal problem in back pain, and we can prevent the spinal surgery. Similarly, in spinal tumors, if they are caught in early stage, these days the technology is very advanced, and with the chemo, radio, and non-operative treatment can cure most of the spinal tumors. It is only in the late stage when the spine is damaged or there is paralysis, we require a surgery. Now, even if, as I just said, that in very few patients we require a spinal surgery, these days we do the spinal surgery by the very, very minimally invasive procedures called laser or endoscopic spinal surgery. We are the pioneers in that. We started way back in the year 2000, and this surgery is done under the local anesthesia using a pencil-thick endoscope, and most of the surgeries are now possible by this. So the complications like the bleeding, infections, injury to the nerves are very less, and the patient can be made up and about right on the same day, and the same week he or she can resume the normal work. So the basic message is that very few people, almost 90% of the patients with backache will be fine without surgery, with proper precautions and medicines and other treatment, and only 10% might require, where the pain is not getting improved by the conservative trial, or they are having paralysis, or the pain is getting chronic. So even in that case, the spinal surgery has become very minimally invasive and safe. So there is no need to fear, and everything is very safe and very effective. So for any backache or a spinal problem, you can contact us at Jaipur Golden Hospital, Rohini, Delhi. I am Dr. Manoj Sharma, Head of Department of Spine and Orthopedics. Thank you very much, and have a nice day and a strong spine.